Hi, and welcome to On Air with Vyaire, podcasts from the front lines, an educational podcast series featuring discussions with frontline medical experts about their experiences ranging from airway management or the dynamics of recognizing, preparing, and managing patients with COVID-19. At Vyaire, we are truly proud to partner with you on the front lines of the COVID-19 global health crisis, and thank you for the work you are doing to help improve outcomes for patients with COVID-19 around the world. The host of Podcasts from the Front Lines is Vyaire Vice President, Medical Director Michael Pedro, MD. This episode is focused on surgical procedures during COVID-19 and features our guest medical expert, Dr. Felipe Urdaneta, anesthesiologist, President of the Society of Airway Management, Associate Professor, University of Florida. This podcast is for educational purposes only. The scientific exchange content in the podcasts from the front lines may address the off-label use of Vyaire devices and supplies that are the sole responsibility of the device or supplies owner, and is undertaken with the understanding that the owner assumes all liability for such use.
On today's episode, we'll discuss protocols for restarting elective surgeries. Now, the ACS, ASA, and AORN came out with their joint statement. However, it lacked many details, and it left hospitals open to develop their own policies. Joining us today to discuss some of those finer details is Dr. Felipe Urdaneta. Dr. Urdaneta is a board-certified cardiac anesthesiologist and considered a world-renowned expert in the field of difficult airway management. He is currently president for the Society of Airway Management, associate professor at the University of Florida, and serves as director of out-of-OR anesthesia. He has numerous peer-reviewed publications and lectures all around the world, focusing mainly on difficult airway management and out-of-OR anesthesia. Dr. Urdaneta, it's a pleasure to have you on today.
It's a pleasure to be here. Thank you for having me.
Now, have you determined what types of surgeries that you're going to start off with, if you'll be doing inpatient surgeries or larger?
Yes, definitely. I think that the surgeons are going, they basically were given kind of, when all this was happening, to prioritize their procedures depending on the severity of the disease, or depends on the patient, the degree of cancer or whatever it was. And I'm pretty sure there's going to be a period of just basically doing what's strictly necessary and then go back to the things that can wait. In other words, if your procedure can wait, it will wait for while we catch up. And I hate to say that because we will never catch up. We just lost 6 weeks of our time, and I don't see any way that we can recover anytime soon, because the patients are not the same at the present time. So I'm pretty sure we're going to be dealing with folks that have not had their surgical procedure that was planned for months and all that. I do a lot of cardiac, so I'm pretty sure that the valve is smaller in area, or worse, the coronaries is more pronounced, and whatever. It's going to be kind of challenging, very challenging what comes ahead.
Yeah, I mean, that was going to be my next question. Given that there is such a backlog, is there any plans to extend the hours that we're normally operating?
There's been a lot of rumors, and I think eventually we will have to overcome and verticalize the operating rooms and extend the hours and all that. However, we have to realize that comes with a price as well, because if you're going to have surgery 24/7, you need to staff those surgical suites 24/7 and recovery and ICU and all that. So that's going to also consume a lot of resources and money. And so we have to be careful. I think we need to basically realize that we've never gone through this, not for this period of time. So I'm pretty sure there's going to be an adjustment for everyone.
Thank you for joining us today. To suggest a topic for future podcasts from the front lines, or to stay informed, please visit us at vyaire.com.